Hello, good morning. Welcome on my channel, Charming Science. Today we are going to see the bone radius. So, if we talk about the radius, then we will see that the radius is the lateral bone of the forearm. So, this one is the radius, and this is like laterally side of the forearm. And when we compare it with the lower limb, then we will see that it's just like as a tibia. When we talk about the radius, it's having an upper end, it's having a lower end, and it's having a shaft. So when we are going to talk about the radius, first of all we have to know how we determine its side. For determining its side, when we look it from the above, from the superior side, we will see that there's a disc-like structure. Disc-like structure, or we say that the disc-shaped head that is present at the upper side or the proximal side of the humerus. And when we look at the lower side of the radius, we will see that there is having a styloid processes. These are the this is the lower side of the radius. So when we look at the upper side, we will see that there is having a disc shape like structure which is present at the proximal side of the superior side of the radius. And when we look at the downside or the inferior side of the radius, we will see there is having a styloid processes. When we come at the lower end, first remove it. When we come at the lower end, we will see how we'll distinguish between the anterior and the posterior surfaces. So when we come at the lower side, at the anterior side, we see there is having a thick prominent ridges at these places. We will see that there is having a thick prominent ridges, while the posterior surfaces have grooves. So when we look at the posterior surfaces, we will see that there is having a some grooves like structure for the extensor processes or the extensor tendons, where the extensor muscles are going to attach. When we look into the shaft, the sharpest border of the shaft, when we look at the medial border, then this border is in the sharpest one. So the sharpest one border is the medial one. And there is having also a radial tuberosity will be present at the middle side of the shaft. Lower end presents a tubercle on its posterior surfaces, and this is also known as the tubercle of Lister. There is having a structure that is known as the tubercle of Lister. So again, when we are going to see the radius bone and we have to know about how we determine its side, first we have to see the disc shaped structure that is present at the proximal. This one is the proximal one, and the styloid process which lie at the inferior side. When we have to get to know about the anterior and the posterior one, so at the posterior side there is having a groove. There are 4 grooves approx, which is for the extensor tendon. And when we look at the anterior side, we will see there is having a some thick prominent ridges that is present there. How do we determine the medial one and the lateral one? The medial border or the middle side of the radius is the sharpest one, then the lateral one. So that's how we are going to determine all the sides and determine the bone of the radius. So when we come at to see the what are the special landmarks which are present on the radius, so we have a two structure, that is one is the in the supination position. This one is the supination and this having in the pronation structure. So when we look at the upper head or the upper hand of the radius, so this is the upper end, lower end, and there is having a shaft structure. So when we look at the upper side or the superior side, we see there is having a disc shaped structure. This one is the disc shaped structure that is covered with the hyaline cartilages. So this is structure, we will see that this is the hyaline cartilages that is present on toward the head. It's generally a concave in nature, and we will say that this structure is concave in nature, and it articulates with the capitulum which is present on the humerus. It's going to articulate with that point, with the humerus or the capitulum of the humerus. There is having a ligament that is present there, which form the humeroradial joint, which is the annular ligament that it surround the radius of the head. When we will see that the neck, the another structure is the neck. So neck is the landmark, especially landmark for the annular ligament, that the limits of the or the boundary of the annular ligament which lies at the level of the neck. And neck is enclosed by a narrow lower margin of the annular ligament, so that it, or we will say that the radius will rotate during the supination and the pronation freely inside the capsular ligament or the annular ligament. When we just come down, we will see the radial tuberosity. This structure is known as the radial tuberosity. So radial tuberosity, it lies toward the medial side, or the middle side, which one, which is the sharpest side of the radius. So it lies in the upper end of the radius, and it's known as the radial tuberosity. It has a rough posterior part and a smooth anterior part. So when we come at the, we'll talk about the radial tuberosity. Now when we come at the shaft area, we will have a 3 border and 3 surfaces. So the anterior border, when we talk about the anterior border, this one is the anterior border. So when we talk about the anterior border is extend from the anterior margin of the radial tuberosity. So let me remove first. So and to draw it with the another one. Yeah, this one is good. So wait. So the anterior border, we will see that this is the line that is starting from the radial tuberosity. Okay. So the anterior border extends from the anterior margin of the radial tuberosity to the styloid processes towards the styloid process. This one I have marked a little longer. This lies toward little here. Okay. So the anterior border extends from the anterior margin to the radial tuberosity to the styloid process. It is the oblique in the upper half of the shaft. When we will see that the upper half of the shaft, then this is the oblique in nature. This structure is oblique in the nature and vertical in the lower half. And we will see that this is the straight one or the vertical in the lower half of the shaft. When we will see about the posterior border, this one is the, in this structure we will see that the posterior border is here in the when we will see the radius in the pronation. So the posterior border is the opposite of the anterior border, but is clearly defined only as a medial one third. The upper oblique part is known as the posterior oblique fiber. So we will see that this is the posterior border. The posterior border will lie here from the posterior side of the, and it goes towards this, just towards the posterior side of the radius, or towards the posterior side of the radius when it's in the pronation. When we will see about the middle or the introsi border, this one is the introsi border. This lies toward the medial side and the introosseous membrane is going to attach on it. So the medial or the introosseous border is the sharpest of the three one. We will talk about this in the when we are going to when we are talking about the site determination. Then we get to know that the radius, the medial one side of the radius, is the sharpest one. So the interosseous membrane is going to attach onto the sharpest one, and it's known as the interosseous border. It extends from the radial tuberosity. It's going to extend from the radial tuberosity above the posterior margin of the ulnar notch and attached to the lower 3/4. That is the lower 3/4 of the radius. In its lower part, it forms a triangular region. That is not for much detail. These are the things that is present at the shaft. When we talk about the surfaces, the anterior surfaces, if I am going to remove all this. So when we talk about the anterior surfaces, this is the anterior surface. So when we talk about the anterior surface lies between the anterior and the interosseous border. So when we are talking about the anterior border, so it starts obliquely from the radial notch and then vertically toward the radius, and this is the interosseous border. So the anterior surface lies between the anterior border and the interosseous border. And when we talk about the supply, then in this the anterior surface, a nutrient foramen or the nutrient artery will come here from the upward sides, and then it also supply to the interosseous artery or the interosseous, divided into the interosseous artery and supply to the interosseous membrane. When we talk about the posterior surfaces, here's the thing. This one is the posterior surfaces. So the posterior surface lies between the posterior border. This one is the posterior border, and this one is the middle one is the interosseous border. So the posterior surface lies between the posterior border and the interosseous border. The lateral surfaces, is lies between the anterior and the posterior border. It shows as a roughened area in its middle part. Okay. So when we are going to talk about the its lower end. So when we are going to see about its lower end, we have to see it if there is having a little 5 surfaces on its lower end. So when we are going to discuss about the lower end, let me remove all the things. It's enough. It's okay. So how we determine its sides? The anterior surface is in the form of thick prominent ridges that is present. We will see better in its teeth. These are the ridges, thick ridges. These are the thick ridges that is present onto the anterior surfaces, and the radial artery is also palpable against this surface. We can palpate this artery at these surfaces. That's the clinical aspects of the bone. When we look at the posterior side, we will see that there is having a 4 grooves. 1, 2, 3, and there is having another one, that is the 4th. No, wait. This is the first one, second, third, and the 4th one. There is having a 4 grooves that is present for the extensor tendon, and at the dorsal side there is having a oblique groove that is known as the Lister's groove. So if I am going to clear it, we will see there is having a groove. This is known as the dorsal groove or the groove for the oblique groove, or we will see the dorsal tubercle of Lister. Dorsal tubercle of the Lister. When we'll see its medial part, that's having the, when we will going to see about the medial part, there is having a ulnar notch. there's having the ulnar notch where the distal radio-ulnar joint will be formed. The lateral surface is prolonged downward to form the styloid process. The lateral surfaces is going to a little downward, so it will form the styloid processes of ulna. And the inferior surfaces bear a triangular form area for the scaphoid bone. So when we look, see the distal part, then there is having a scaphoid bone where it's going to make an attachment with the scaphoid bone or with the carpal bone. These are the structures we will see that these are the landmarks which is going to present on the radius. So when we are going to see about the inferior side of from the inferior aspects, we will see that this one is the first structure. One is the styloid process of the radius. The second one is the dorsal tubercle or the tubercle of the lister. The third one is the extensor groove for the tendons of external carpi ulnaris. This one is the ulnar bone. Okay, so this one is the ulnar bone. So we are not going to talk about the ulnar bone. The first one is the styloid process of the radius, the tubercle of the listers, and the fifth one, this is a facet for the scaphoid bone, that is the carpal. Sixth one is the facet for the lunate. Okay, and there is having a structure ulnar notch which is present on the radius for forming the inferior radial ulnar joint. So let's come when we are going to talk about the muscles attachment. What are the muscles and how they are going to attach onto the surfaces of the radius. So by the structure we get to know that this is one is the radius one. So there is having attachment for the ulnar one also. So we are just going to talk about the radius bone. Okay, so we'll start it from the upper side. We have to remove this one, so you will not get so much confused from this structure. So we are going to just to do focus on the radius one. So when we are going to see the radius one at the upper side, when we are see the radius at the upper side, we will get the attachment for the brachialis muscle and the biceps brachii muscles. So the biceps brachii is inserted onto the rough posterior surfaces of the radial tuberosity. So when we are going to see about the muscles, then this is the insertion of the muscles. Let me draw in a blue one. So this one is the insertion for the brachialis muscles and the biceps brachii muscles. These are going to the insert at the rough posterior part of the radial tuberosity. So this is the radial tuberosity and this is the posterior part of the radial tuberosity where the brachialis and the biceps brachii muscles is going to insert. When we let me remove it. When we see at the supinator muscles, it's inserted onto the lateral surfaces. So these so when we talk about the biceps and the brachii, they are going to insert at the posterior surfaces. When we talk about the supinator muscles, the supinator muscles is inserted onto the upper part of the lateral surfaces. So the supinator muscles is going to insert at the lateral surface up at the upper end, at the upper end of lateral surface of the upper end of the radius. The supinator muscles is going to insert. When we are going to see about the flexor digitorum superficialis. When we are going to see about the flexor digitorum superficialis, it's going to originate from the radial head. Below the radial tuberosity, it's going to originate from the anterior oblique line. It's going to, from the radial head of the flexor digitorum superficialis, take origin from the anterior oblique line and the upper end of the anterior border. So when we are going to talk about the flexor digitorum superficialis muscles, the flexor digitorum superficialis is going to originate from the anterior oblique line, that is the anterior oblique line which is present from at the anterior border of the radius, that go from the obliquely from the radial notch to the anterior border and then goes vertically. From that oblique line there is the muscles, is the flexor digitorum superficialis is going to originate. When we talk about the flexor pollicis longus muscles, the flexor pollicis longus is going to originate from the anterior two-third of the, this is the anterior two-third of the radius is going to originate. When we talk about the pronator quadratus muscle, the pronator quadratus is going to insert at the lower part of the anterior surfaces. At the lower part of the anterior surface of the radius, the pronator quadratus is going to insert, and there is also having an insertion of the brachioradialis muscles. The brachioradialis muscles is also going to insert at the lowest part of the lateral surfaces, just above the styloid process. So there is having a styloid process that is present in onto the radius. So just above that, there is having insertion point of the brachioradialis muscles. So these are the normal muscles which is going to attach on the anterior surfaces of the radius. So when we are coming at the posterior surface or the posterior aspect of the radius, so we will see that the biceps brachii muscles, the biceps brachii muscle is going to insert at the rough posterior part of the radial tuberosity. So this is the posterior part of the biceps brachii. We also see that there is having a insertion point that we will see in the anterior view, but this is the most prominent in the posterior view. So on the posterior surfaces of the on the posterior surface of the radial tuberosity, there is having an insertion for the biceps brachii muscles. The supinator muscles. The supinator muscles is insert at the upper part of the lateral surfaces. This is one is the lateral surfaces, and there it's going to insert and it's going to originate from the ulna. When we talk about the ulna, then we will say where it's going to originate, but it's so the supinator muscles is going to insert at the upper part of the lateral surface of the radius. It's going to insert. When we talk about the pronator teres muscles, the pronator teres muscles is insert at the middle of the lateral surfaces. So this is the lateral surface, it's going at the upper one third. We will see the upper part of the lateral surface, it's going to supinator muscles is going to insert at the middle part. This is the muscles, the pronator teres muscles is going to insert. When we talk about the origination, so there is having a muscles abductor pollicis longus. The abductor pollicis longus and the extensor pollicis brevis. So these are the two muscles, the extensor pollicis longus, this one area, and the extensor pollicis brevis. So these are the muscles are going to arise from the posterior surfaces of the radius. Brachioradialis muscles is going to insert at the just above the styloid processes. When we will talk about the interosseous membrane, There is not having a attachment for them. So when we are going to talk about the interosseous membrane that is going to attach, we have to also talk about the pronator quadratus. No, we talked about that. So we are going to talk about the interosseous membrane. So the interosseous membrane is attached to the lower 3/4 of the interosseous border at the radius side. And when we are going to talk about the grooves that is present here, so we will see that the first groove between the crest, like lowest part of the anterior border, and the styloid process give passage to the abductor pollicis longus and abductor pollicis brevis. So this one is the first groove that is going to give attachment to the extensor pollicis brevis muscles, and the abductor pollicis longus muscles is going to from this part. The second groove between the styloid process and the dorsal tubercle. So this is the styloid process and this one is the dorsal tubercle. So the second groove is going to give the attachment or give the way to the extensor carpi radialis. So this one is the groove where the extensor carpi radialis and the extensor carpi radialis brevis tendon will go or travel from this route. The third oblique groove, medial to dorsal tubercle. So this one is the, if you get to know, this one is the dorsal tubercle. So medial to this one, this groove is the third one groove is going to give the attachment for the extensor pollicis longus muscles. It's provide the way for the extensor pollicis longus muscle. And the fourth groove on its the medial side, it's going or it's give passage to the tendon for the extensor indicis. This is the way where the extensor indicis, posterior interosseous nerve, anterior interosseous artery, and the extensor digitorum, all the four things, that is the extensor digitorum, extensor indicis, posterior interosseous nerve, and the anterior interosseous artery, these are going to travel it from the fourth groove. These are the things of the radius. So if we are going to talk about the ossification centers, so the primary center in the shaft, the primary center in the shaft, primary center is going to, in the shaft there is having a primary center which is appear at the 8th week of development, and the lower end ossify from a secondary centers. So the shaft having a primary center and the lower end having a secondary centers which appears during the first year, and it's going to fuse at the approx 20th year in the growing bone. The secondary centers of the upper end, it's appear during the 4th year and fuses at the 18th year. So there is having a three centers. One is the primary which is present in the shaft, and it appears at the 8th week of development. The lower end having a secondary center and the upper end also having a secondary center. The lower end center appear at the first year and fuse till 20 year, and the upper end secondary centers appear at the 4th year and fuses till the 18th year. These all are the anatomy of the radius. We are going to conclude it right now. I hope you all are getting all the answers of your anatomical position and anatomical landmass and the muscles attachment in this video. And if you have any comment, any suggestion, anything, then you can tell us. We would like to improve it. Thank you very much.